To Des, I'll hand over to you now and let's get going on the noticing framework.
Thank you very much, Laura, and hi everybody. I recognise a number of faces and names in the list, though not everybody. So yeah, I'm part of the iHub within Healthcare Improvement Scotland, and I've been leading on work. I guess it's the colliding of worlds between self-directed support and commissioning practice, which is at the heart of it. But within that is a focus on communities. As I get, and always a kind of sweet spot of, if we really want to have a sustainable health and social care system, we need to have a different way of working um, across our public sector, our third and independent sector partners, but most importantly with people and with communities. And in doing that, it's been a focus of relationships. So my work has always been about the relationships between different partners. So it comes under the head of commissioning, heading of commissioning, but it's very much about relationships. How do we do some of those boring things like commissioning and procurement in ways which actually help us to achieve what self-directed support set out to do over 10 years ago? And we're still far away from it, unfortunately. But there are good examples across the country of moving that right direction. And the bit we're going to talk about today is something which I think might help us in making this the way we do things, or beginning to develop a different landscape of how we do things, which fits with what SDS was about. SDS was always about, it was an update to the Social Work Act. So it was always about doing differently. It wasn't an add-on. It wasn't something different. It wasn't we do SDS or we don't do SDS. It should be the way that we do health and social care. And I think that there's something in what I'm about to share today, hopefully, that is beginning to gain traction in terms of people how to think about how do we make the good stuff that is there begin to really stick and become the way we do things. So I'm going to share screen if that's okay. So hopefully that's come up. I don't know if anybody can give me a wee nod. Does that look as though that's come up okay? Yeah, lots of nods. Thank you very much. So human learning, so just to give you a bit of background, the noticing framework needs to sit in context. So noticing it sounds like such a bland word. Why on earth would we be talking about noticing things? Surely that should be what we do anyway. And I'll come to why I don't think it's quite what we do just now, or we don't use what we notice as effectively as we might, and that's because of the system that we operate within. So human learning systems is very much about how we change and turn the world upside down. So there really should be a full stop between each of those human.learning.systems. And it's because at the moment, human beings have to learn how to fit into the system. The system operates as it does. You need to find the right front door, whether you're a carer, whether you're somebody living with a learning disability, whether you're older and maybe beginning to feel a bit more frail. All of those things require you to identify first and foremost, maybe with family and friends, but certainly yourself in some way, shape or form, have to find as a human being your way into the system. Where's the front door of health and social work? Is it A&E? Is it a social work department? Where is it? Is it through a local third sector organisation? So we have to find our way. We have to learn how to fit into the system. The system is as it is, and then we have to adapt to that. What we're trying to do is to turn the world upside down and say, so we know that the current system doesn't work, and it doesn't work well at all. It's quite a broken health and social care system. We know that we've got increasing demand, we've got less money, we've got issues with recruitment and retention of staff, all these sorts of things. It's a system that's not working well. So what the aim is to have a system that learns from humans. So let's actually take what does work well for people. Let's have good conversation, asset-based, a lot of jargonous stuff, but how do we actually build on people's strengths, on community strengths? We saw that during COVID there was an awful lot where communities rallied around each other. People started looking after each other in ways unbidden, not because of an assessment, not because of eligibility criteria, not because of anything the system did, but quite simply because we're human beings looking out for each other. What do we learn from that, and how do we actually start taking that in and reshaping our health and social care system based on what works for people? So really starting from people. When I say upwards, it always feels wrong as well, but from people outwards towards our communities, towards our system, and that's what we're trying to do. So the improvement, and coming from an improvement body, improvement is about not making the current system better, but actually changing the current system. And what informs that change? or what should inform that change, is not policy and procedures from above and legislation, but it should be driven by what really works for people. That is at the heart of SDS. It was always there. So how do we do that? So we've kind of got a kink in the pipes at the moment. We've got something which is about, there are good examples across the country of good conversations, really, working with people, trying to understand what matters. I think there's been an awful attempt over the past 10 years in terms of SDS to change things at local level, to have conversations, to understand people, but it hits a system that is still top down, that is still driven by performance indicators. And the performance indicators are about current systems. So it's in health, it's things like waiting times, it's delayed discharge. In social care, it's things like eligibility criteria and waiting lists for services, etc. So we have a system which is trying to administer from top down. And yet we have a narrative which is about self-directed sport, realistic medicine, community empowerment, all these things which are actually saying we should have empowered individuals and communities. So there's a kink in the pipes. There's a difference between how we do things here, and that's what we're trying to unblock. This is a scary one. You don't need to read the detail of it, but to know that that is the obesity map. And part of the reason this is important is because the way that we try to solve problems at the moment is simple in the terms it's cause and effect. It's and the way that we commission services to solve problems in relation to social care in particular is that we think an organisation can be commissioned to fix people. And I'm being a bit crude in my language here, but it's the idea is that we can identify, assess need, put in a service, and that fixes a problem, which we all know doesn't. Especially home care is a classic example of that. 15-minute calls is not fixing anybody's problem. But we've come from a place of trying to fix problems, but we're not really then addressing people's actual social care, health and well-being needs within that. And this helps us understand a bit about why we're off mark for this. So this is the obesity map. A bunch of healthcare professionals locked up in a room and asked, well, told you can't come out until you identify all the factors that affect obesity. This is just an example of something that happens to be around obesity. So there's 108, you can't read them there obviously, but there's 108 factors identified in there, and they are grouped into things like media, education, early life experience, food and production supplies. So there's lots of things that affect any one person's particular relationship with obesity or experience with obesity. What you'll see there in blue is 4 healthcare and treatment options. Now, this is a piece of research done. This isn't in any way kind of spuritive work. This is evidence-based work, and there are 4 healthcare and treatment options. So the chances of those 4 healthcare and treatment options fixing anybody are pretty close to zero. What they can do is they can bring expert advice and guidance for people to think about their relationship with education, food supply, all these other things, so they can help somebody achieve an outcome. But they certainly cannot deliver an outcome. And that's really important in terms of SDS. The notion, and in fact of health and social care, the notion that we can purchase a service or deliver a service, and delivery is my pet hate, and it's one of the key problems is that we have this notion that if you deliver a service, and the connotation there is that if you deliver something, then the thing is right. And if somebody is not therefore succeeding and they're achieving their outcomes, then it's something that they're doing. It has those kind of connotations. If you deliver something, that the thing itself is the right thing because it's concrete. It's a delivery. You deliver parcels. You don't deliver care. You can care for people. So it's changing that kind of dynamic and understanding of what that means. And the reason that's important because is that we then have a performance framework around this, which says, are you delivering well, on time, enough of numbers, all these sorts of things. And if you look at the performance stats around health and social care, again, it's things like it is numbers games. You see it also in education in terms of school league tables. None of these things are really helping us actually address the underlying problems in these, which is why we're over the 10-year SDS strategy and it's still not embedded. Because we've had a mindset which is around how is SDS delivering on our current performance framework? And of course it won't. It never was intended to. It was actually intended to change the shape and way that we work with people to actually enable people to achieve their own outcomes, not for us to deliver outcomes to them. And that's really important as starting points here. So therefore, what we don't have is a kind of, and having been a commissioner and a committer of these sins, I can't lock myself away in a cupboard and write a service specification for a service to be commissioned that will fix obesity, learning disability or any other aspects of health and social care, even with good colleagues, even with going out and doing good consultation, it's not a simple problem. It's a complex problem. So the world is complex. We all know that. I think it's just about reflecting that and acknowledging that that's the way in which that's the world we're operating in. And another way of putting that is thinking about an apology. The language here is not necessarily the most appealing. But that kind of ecological system, recognizing that there are things at macro system, there are big things around us in terms of economics and laws and stuff, but there are also local things in terms of our local microsystem, the things that are around me, my family, religion, my peers, all these sorts of things. So again, and if people have seen the SDS map that was created a few years ago, it very much was again trying to turn the world upside down so that the person is not at the bottom of the pile, but they're actually supported by family and friends, by community. And that has been the attempt of SDS all along, but our current system is not constructed that way. And again, it goes back to, so what we're trying to do is bring forward the learning from human beings' experience, from people's experience, to change the system. And that has to be the driver here. We have to be changing our system, not saying let's do the same things better. So this sounds like a tangent. It sounds weird to be talking about, so public management. Why are we talking about public management when we're really talking about people? Because it's one of those boring system things that's getting in the way. And unless we address it, it continues to be a barrier to actually achieving the things that are, I think, in everybody's hearts and minds in terms of health and social care, about actually people first, what matters to you. We've just, last week was what matters to you today. We've got lots that celebrate and kind of focus on individuals and really being respectful of that, and building on people's strengths, asset based, all these things. But we still don't yet have a system that does that. And the way to kind of really change that is to have learning as a management strategy rather than performance. And I'll explain a wee bit why. So, a very simple, and it might not look simple on the right hand side, but a very simple part of standpoint is a learning cycle and what that means. So the bit at the top is understand the system. So at a person level, that's about understanding the person. That's the good conversation. That's the good conversation that we've all been talking about that should be at the heart of this. So not tell me your worst day so that I can get you through an eligibility criteria to get a service. Tell me about your life. Who are you? What works well? Tell me when it's a good day. What does that look like? Who's around you? Who's not around you? Having a good conversation about understanding the person, John Smith, whoever it is, really understanding that person rather than saying, my job's to assess you for a set of services that you may or may not be eligible for. Again, I'm being unkind in language and forgive me for that, but it's to accentuate the points as to how where a system is driven. Frontline social workers as well to be assessors of situations rather than actually. And if you look at the original social work, it was advice, guidance, and assistance. And what the role has become is assessment for assistance, and not the emphasis on advice and guidance, not the emphasis on that good conversation. So what we've been looking to turn back to, and again across the country there are examples of that happening, and then hits the system and has trouble really engaging in a way which can make the difference you want to make. So a good conversation person. So in chronic pain, do you experience the pain more in the morning? Is it when you lift your right hand, your left hand? Is it certain times of the day? Is it, you start to understand what's your experience of chronic pain, because chronic pain is not the same for everybody, not the diagnosis of the root cause of it in that respect, but actually what's your experience of it? How does it affect your life? Then saying, okay, so let's look at ways that we can address that. So co-design is that thing about the expertise of somebody who is an expert in dealing with chronic pain, bringing that professional expertise, but alongside, and we kind of, again, it can be a bit glib language, but the person being an expert in their own life, lived experience. What that really means, absolutely, is they know best what works for them, what doesn't work for them. So the co-design is about marrying that up, about understanding what is the person's knowledge about themselves and how they experience things, and what's the expert knowledge that can help them understand some of that in a different concept. And then say, okay, let's, an experiment seems again like a strange language, but in effect, it's just a more honest language. It's saying, let's test something we think will help with that, and we'll see if it works. Not, I now kind of prescribe you a service, or an answer, but actually, okay, let's try this. Let's be honest, this should work. This feels like it. We think, etc., etc. Let's experiment with it and be honest that it's a testing of it. It needs tweaked. Actually, most of that works. We need a retweak, or actually, no, that fundamentally doesn't work. Let's go back. So doing that thing about iteration, about understanding what works, and then embedding that. So saying, okay, that seems to work. Let's run with that for a while, but recognizing world changes, lots of things, COVID comes along or whatever. So you need to continue to do that, and that's built into the social work process about reviews, etc. So at a person level, you've got a good conversation which should drive an understanding of what works for people, and all of this is based on learning about really understanding who people are and what works for them. Where it begins to become interesting in a different way is thinking about this part about management structure. That has been happening. People do have good conversations. It then hits a system that is saying, yes, but you still got to have eligibility criteria, you still got to have resource allocation, you still got to have other things which come down from above and get in the way of actually making that happen. So there's not an alignment. So what we're looking at is, so how do you take that learning about what works at individual and begin to feed it up through, if you remember that kind of that micro system thing that we had a wee second ago, from the person, what does that mean for us as a team, that how do we work with that person, but how do we work with 10 people who've got similar but different aspects? What are the similarities? What are the differences? How does it mean for us as an organization? So you begin to push information up and you ask questions. You say, if this is the case for these 10 people, how should we be working differently? Do we need to engage different partners? Do we need to work differently as a team, as an organization? Do we need to feed that up to place level so that we're looking at it across IJBs, integrated joint boards, etc., across organisations? What does it mean in Highland, or in Orkney or whatever? And then think about, are there things that really need to push up into how we change and influence legislation? So you start to have things about, and this is language again, helpful or not, interconnected learning cycles, a bit of a mouthful. It's a joining up. It's a joining up of those learning cycles at a personal level. What are we understanding that works for each individual? And then what does that mean for system level? So an example in a slightly different environment in Gateshead, where the trigger for recognising some social issues was people who were in council tax arrears. What they recognised was that the system's view was that most people in council tax arrears could pay but chose not to. So the system response is that you send out a letter saying you've not paid, says it very nicely. Next one says you've not paid and you're in trouble. And the next thing is you get the bailiffs round and you have a process. There's a system response to that type of thing. What they did was that they said, instead of doing that, let's actually go out and find out what's going on with those people. And what they found is that 98%, a group of 80 people, 98% of them could not pay, but they started to understand why they couldn't pay, and they started to look at what the issues were. People having a mother a single mother who had a family and had several jobs, and one by one lost them because she was trying to manage a situation with a neighbour who was causing problems when she wasn't around for the kids. The answer to that would have been to get a move to another property. The system says, no, you can't do that because you're a bad person, you don't pay your debts. Those are system responses which show no insight, and performance responses which no insight. But when you start to unpick that, you begin to see something different. Closer to home, North Lanarkshire have been doing this in their again unhuman language, high resource users. What that means is system language is the people that keep coming back to the front door of A&E. And in system language, that is high resource users because it's a small percentage of people using a lot of resource. What it really is people who are not getting the support they need and therefore don't know where else to go turn to and keep coming back. 56 people there, and when they worked with those 56 people and began to find things that really worked, what they understood was, of course, poor housing, actual poverty, poor diet, loneliness, social, nothing surprising at all, but actually digging into what makes a difference here. And they've now got a situation where they are a recurring saving of £500,000. So if you put it back into system language, the main thing is people's lives are much better because they've addressed issues. But you put it back into system language, you don't have them coming to the front door all the time, and they're saving £500,000 a year. So you begin to, but that only comes because you really have that focus on learning and understanding what's at the heart of it. And I absolutely acknowledge this seems bleeding obvious to me. It probably does to you, but it's not how we've been working. We've been working to performance targets about waiting times, etc. Our focus in trying to address these big issues has been on performance, which take our focus away from people to those measures around delayed discharge, about waiting times, about all these sorts of things, eligibility, and have taken our eye off the ball of, well, actually, let's focus on what really works for people and fix the system, as it were, from ground up. So what you begin to do with that is you start saying, you challenge business as usual. So you bring things forward to say, see the way we've been doing things, that's not working anymore. Because a lot of those things are 10, 20, 30, 40-year-old systems. They're absolutely out of date. So how do we actually bring forward learning to inform, well, what are the changes we need to make? And that's a learning focus. So you begin to say, so you look at things for this one, for organizational, what's the maximum of caseloads for workers? So if we're going to work in this way, do we need to think about that differently? What information systems do we need? How do we connect information? Shared reflective practices, which is the point of today, and we will come to that. So you begin to think about the whole world a that bit differently. And then you can take that up to place level, thinking about how those patterns play out between organizations, and you get this, and you'll not read the detail of it, but you get something which begins to acknowledge that really sitting behind this complexity is situations which are learning cycles happening at all these levels. And we all have to have this active focus on learning. And how do we pass information between those levels? Now, this in some ways feels a bit, it's almost like going back to learn to drive a car, because actually what we're doing is breaking down a system which just happens and we don't question, but it's performance driven. We think that performance indicators, if as long as the figure goes up or down, depending on what the figure is, we're getting better, or we're getting worse and we know it. Actually, this will begin to break that down. So if you had to relearn to drive a car, that whole thing about, mirror signal maneuver and all that thing, you kind of get a wee bit stuck. So it does feel quite detailed, this, and I acknowledge that, but that's because we're having to unlearn habits, and we will need to learn new habits. So bringing this back to people, human learning, human approach to healthcare. This is an example in Forth Valley around pre-diabetes. So John's kind of the pathway that would have been, you can see in the top there in the blue, is a process-driven one, and that's how that kind of situation for John would have been dealt with before, kind of passed by the ANP for health lifestyle advice. You're passed through a system triage, um, and it costs. There's a lot of time involvement there, 4.5 hours and actual professional time, but it took 10 months to resolve. And this is a small scale problem, and a cost attached to that. When you began to unpick it and understand what's going on from a human pathway, and again, this is based on a real example, you begin to recognize things like how people felt during that, about, being worried, afraid, confused, surprised about things. When you begin to understand things differently, you see those feelings play out, and you see a human response to that below, which is about, involving family, which is a process which wouldn't have happened in pre-diabetes and in that environment. Normally, your patient is your focus, and people may have experienced that. It's about the patient, it's not about the family around it, sort of thing. So when you actually began to work differently and respond to those feelings, respond to those experiences, what that found was and the reason they did this work was because it took more time at the beginning, but ultimately it was 2 hours. So getting those good conversations right at the beginning, then that problem was resolved in 6 weeks and at a much lesser cost. It's a very small example for that individual, but it really highlights that thing about it. And Vanguard did work around this from a number of years ago, and they produced a report, Saving Money by Doing the Right Thing. So a lot of what's driving behaviours at the moment is we've got less resource, finances, etc. And we keep thinking about, so how do we do enough for people with less resources? But our focus is still on the money. But actually, if the focus is on doing the right thing, it's not that the money takes care of itself. I wouldn't want to kind of put it forward as some kind of silver bullet in that way, but you certainly don't see the concerns that are around about that actually this is going to cost us a fortune. You actually see a lot more efficient use of resources in the overall system. So that's the why. Now, to get to that, what are the tools? How do we start having a behaviour which is focused on learning rather than performance? And the starting point of that, you can use a couple of things. So appreciative inquiry is something that's used a lot, and if people are familiar with that, I'm not going to go into today, but that's a way of a conversational approach as teams looking at kind of defining what's the topic you're working on, discovery, what's already working, that dream again seems a strange word, but it is a thing of it. It's the art of the possible. How could this be different? How would we design? What are the options to make that happen? And it does use the delivery word, unfortunately, but it's making it happen. What's your action planning? So you've got a piece of inquiry is one tool. The thing I'm going to talk about today is got a really simple name, a noticing framework. Um, and again, it just seems like noticing, it seems such a benign thing. It's like, well, noticing isn't going to make anything different. But it's that how we use what we notice. What do we learn from what we notice? And what's our response to that? And actually, governance based on that is much better governance because it's governance based on understanding rather than a notion that as long as that number goes up or down, things are getting better or worse, that somehow has meaning there. It doesn't. And it doesn't lead you to any solution focus, and it doesn't lead to innovation because it locks you into the current system. So a noticing framework is something which, in its very simple kind of concept, is about sense and respond. What's happening? What does it mean? Where could it lead if we do or don't act? Really basic questions. And then in terms of response, what should we do? How will we do it? And then actually doing it. And that's the key point then, is that last bit, doing it. So it's not just about noticing, it's about using that noticing framework in a way which leads us to action. So breaking it down a bit, as I was saying, and this was something that was created by one of the organisations that's been alongside the Human Learning System journey from the beginning, Easier Inc. So breaking it into that outcomes, capabilities, and patterns. So we don't commission for outcomes, and one of the best examples of this in practice is in Plymouth, where they are commissioned to learn. So the relationship between the public body in terms of its finances and its resource allocations, etc., to third and independent sectors and communities is not to commission them for outcomes, which almost seemed like the right thing because it's focusing on what the difference it makes, but actually to commission them to learn. And when you commission them to learn, what that means is like that they continue to see things, notice things, learn from those things. So have conversations. What does that mean? What does it mean for our finance people mean? What does it mean for clinicians? What does it mean for the people? So learn from that and respond to it, make a difference, and then look and say, what was the impact of that? So you have a different type of cycle, and that governance really informs local politicians and others who have those kind of rules about accountability, because you actually understand what's going on, you understand the changes. So breaking that down here, apologies if the right hand side is maybe not as clear as it could be. When I send this round, hopefully you'll get a copy that is a bit easier to read. So what are we trying to achieve? And you're kind of working from the top right backwards and along. What are we trying to achieve in terms of outcomes? Which few things do we need to excel at? So begging to break that down. If we do this well, let's pick the top 3 things that would really make that happen. It's not trying to solve all the bits of that complexity, but getting into sort of what few things do we need to excel at to be really good to them. What makes doing these things hard? So it's understanding opportunity and barriers. It's that kind of language. What are the patterns? And this is a bit, so going back to that example that I gave round about Gateshead, what they started to recognise that within that, the kind of patterns led them to make changes in um, uh, their allocations policy in housing and their financial assessment processes. So they began to see patterns about saying, well, actually, what this tells us from these 10, 20, 80 people is these are the kind of changes we need to make into our system. And that came from understanding patterns. What are the capabilities? What do we need by capabilities to do that? And then what are the outcomes? What's the difference to that? So that's breaking it down a wee bit further. So outcomes. So when I initially explore outcomes, we suggest using open questions. So this is breaking it down. This is really the detail of it, and it's something which um, I'll talk through just now, but really it's something for you guys to take away and think about how you might use this. So again, that what's happening, what has happened, where are things going well, and who are they going well for? What are they experiencing? So again, that focus is not on the broken part of it, but actually, if this is going to work well, how does it work well? How do we know that? What are the positive outcomes? Absolutely, where they're not going so well. So when it's what are the barriers that get in the way of the good things happening? So rather than the focus on the bad as just being a driver to get a service in, actually understanding what's at the heart of that, and then who. So who's involved in that? What groups do we need to pay more attention to? So really understanding the different roles within that. And in this context, that's why it's something which speaking from a commission context, it really begins to understand who's best placed to do that. So in that Plymouth model, they've got an £80 million budget within the Plymouth, and it's to deal with complex needs in drug and alcohol issues. But what they've now got is a group of organisations, including the public sector, including communities, who are now jointly focused on what makes a difference in those people's lives and in that space. Not how do I, as provider A, do my role and do it well and be rewarded for it, or keep my staff employed, etc. But actually, how do we collectively make a difference for people in Plymouth? Can I just check there? I think there's maybe a microphone on somewhere. I don't know if people can just check their mics because there is a wee bit of sound coming through. Um, so it can also help deliberately consider where there may be blind spots. So one of those things that kind of, I don't know if people are familiar with the Shinari window, is that thing, the unknown unknowns. And that very much comes into the conversations round about exclusion. So people who the system describes as hard to reach. I'm not sure that's the right language because actually, it's the system may well find it hard to reach, but the people are there, and it is that unknown. So it's about being able to say where are our blind spots, where are the bits that make our system not accessible to people, because actually that's the point. How do we make our system? There's been a lot of work over the years done around dementia-friendly communities, etc. So beginning to think differently about what that is an issue about inclusion or exclusion. So where have we not been focused? And I think this is one of the ones that helps us to think about the role of carers within this, unpaid carers in particular, because our system hasn't really been focused there. And I think we're still struggling to get there in terms of unpaid carers. Again, lots of good work emerging, but system-wise, that is not how we yet work. And I was up yesterday speaking with colleagues in Highland around how they want to use this approach as part of their changing their commissioning practice around carer services. So once you understand that where we are with outcomes, what's working well in terms of people being able to achieve outcomes, what's the conditions in which people are best able to achieve outcomes? None of this is halcyon, none of this is saying we'll have a system that suddenly fixes everything, but it's making it better. It's moving that journey towards an improvement through change. So in thinking about what are the capabilities, again, that kind of sense and respond loop about what are the capabilities that are needed here in order to do this. And this begins to challenge us in terms of roles and remits. And there's been a few attempts recently, the Berkshire model that we kind of tried a little bit within Scotland, began to do this. And we shared some work earlier this year around about Leeds, who are trying to change the way in which they do home care, to thinking about what are the roles and remits that actually help in this. Who's best placed to do that? When is it community? When is it services? When is it professionals? Understanding that those sorts of what are the capabilities that help us to do that? Not that just this is a job description of a care assistant or whatever, and that's their role, but actually beginning to understand the capabilities that sit behind that. Who's got them? How might you enhance that? How might you use the SSSC's open badge system so that when you're on a remote island in the Orkney, that actually you help local people who live there to have the skills to look after each other rather than thinking of how do we provide a service. So beginning to think of it from capabilities. Who's got them? What do they need to have? So again, and this, if you're looking at an example of it, how easy was it to spot what's happening, sort of thing? Are we got the capabilities to understand what's going on here? Is or was it easy to put what's happening in context, understand its significance? Thinking about the decision makings that are behind that in terms of about prioritization, and then being able to translate those decisions into action. So have we got the capabilities across our system to make the changes that we need to make? And that might be from a kind of strategic point of view, or that might be about at team level on a very practical point of view. And then this is the bit where you begin to move into patterns. So beginning to think of that in patterns, this is quite detailed at this point, and if you're doing this at this level of detail, it's when you've really got stuck in a system and you're trying to break it down. Again, it's a bit like deconstructing driving. So you're really needing to go to quite a bit of detail on some of these issues. Your more simple ones, that simple part of sense and respond, you can begin to unpick things much more simply. But when you've got those more naughty kind of complex issues, beginning to have a process here which allows you to break it down. So framing simple statements, what would generally be true is these things, whereas we would want them to be. So thinking about if the system was well, it would look like this. So thinking about the allocations policy within that example in Gateshead, how would the system be working better if the people in who've been using A&E in North Lanarkshire, and this is the bit they're at just now, is how do they translate what they've learned from those 56 people into what is it about the system needs to learn from this? If it was working well, what would that look like? So you begin to construct a service specification, a design, an identification of what the system would look like at those different bits if it was working well. And you're getting opinions on this, you're understanding that from different viewpoints, because for it to work well, it needs to work well for everybody. You need an alignment of that. So thinking, having people in the room to look at how does that work for us for finance, how does it work for us in terms of the clinicians, referral processes, how do we get information about those things, so breaking it down into that. So you begin to have something which takes that sense and respond and looks at it in terms of what you're observing, kind of orientation part of it. Is it easy to make contextual sense of what's happening? Can we see this in context of the local system? Does it join dots? And then to anticipate, to understand how this might play out. Going back to that learning cycle thing, this is your experimentation. And then you've got that decision about what you do and then acting on it. Oops. So, and then seeing the patterns. So that's the point at which you're beginning to, now you've brought those different perspectives around your issue, and where you've seen an issue, you're co-learning, which is that last bit, and actually bringing people to have the conversation around this. Learning isn't something that one person does. One person does the observation. Learning comes from the conversations between people to say, this is what that meant for me, this is what it meant for me, and you begin to understand the complexity of that. So you begin to understand how might we solve these issues so that actually the finance works, the referral process works, the knowing what's available works, all those bits are there, that we actually have something which begins to change that around. And that comes from understanding patterns, because you're not fixing it at that point just for one person. What you're doing is you're saying you're making it more accessible to all, because actually you've understand what sits behind that. And it would, be a group of 10, 20, or if you look at the examples I've talked about 80 people in the Gateshead model, and 56 people and that's one hospital in North Lanarkshire. And at the very minute level at the moment in the Forth Valley work, that has only been 3 people that they've looked at, but they're beginning to understand processes there and look at how do we now work differently with other people. And these are just simple recording tools that can help. I'm not going into them, but it helps people to think, because the part of this is what is the learning, but the other part is how do we develop learning behaviours. We don't have learning behaviours, we have performance behaviours. We are expected to see X amount of people by X amount of time, etc., etc. Our system has that kind of mentality. If you're a commission service, how many people have you been looking after, etc., are very much still driven by those kind of performance measures. This is about bringing to develop a habit at a very basic level. And I now do this on a daily basis, doing what did I notice? One thing I noticed today, one thing I wondered, and one thing I realized. And that's my kind of mantra at the end of every day. And it's the aim of it is to help me build a habit to be more noticing, to be more mindful of what I'm noticing, so that when I bring it into conversations, that you're linking it back to evidence. They say, well, I noticed this because at a meeting last week this happened. And you're beginning to develop as individuals habits. You bring that to teams. So if you did that daily basis, and then each Friday your team meeting was about saying, what were you noticing this week? It's really small detail, but that is the detail in which we need to unpick some of the most naughty issues. And there's the last page is just the next part of that, about how you take that through. That's been a bit of a whistle stop tour. I hope that's been helpful, and more than happy to take questions. It'd be interesting to hear people's thoughts on it as well. Um, any questions or any? Alistair.